Welcome to our 9th virtual and the 134th Williamsburg Economic Development Authority Business Roundtable. We're pleased to be able to offer this service monthly to our local business leaders, and we're glad that you've chosen to join us today. The webinar is being recorded, so you can call in for audio or view it at your convenience. Currently, all the participants are on mute. We're anticipating about 30 people who've joined us for the call today. My name is Rick Overy. I'm the chairman of the EDA, a local business owner and host of the roundtable. In just a minute, we'll hear from our speaker, and at the conclusion of the program, our City Economic Development Director, Michelle DeWitt, will close by highlighting some of the business resources available through the city. We anticipate our program will last about 30 to 40 minutes, and we want to make an efficient use of your time. This new year has started off much like last year ended. We recognize that this is a very difficult business environment for our community, especially for those in the hospitality industry, as we weather the cold months that are difficult in a normal year. But of course, this is not a normal year with the continuing COVID crisis and numbers spiking on the peninsula. The last 10 months since March have been especially difficult for those in hospitals and healthcare. Riverside Hospital is an important economic driver and partner in the city. Today, we're particularly pleased to have the president of Riverside Doctors Hospital join us as a speaker for our January roundtable to talk about our hospital during the crisis. Adria Van Heuser has served as the president of Riverside Doctors Hospital since 2016 and leads a team of almost 400 healthcare heroes right here in the heart of our community on Route 60 and 199. She joined Riverside in 2012 after completing her master's in healthcare administration at VCU and her undergraduate at UVA. Under her leadership, Riverside Doctors Hospital is recognized as the first in Virginia to earn the Geriatric Emergency Department accreditation, as well as certification as a primary stroke center. In addition to serving on the Economic Development Authority Board of Directors, Adria serves on the Business Council, on the Old Town Medical and Dental Center Board of Directors, and as a trustee of the Williamsburg Health Foundation and Walsingham Academy. In 2019, she was named to the top 40 under 40 in Hampton Roads by Inside Business and completed the LEAD Greater Williamsburg program in 2019. She also co-leads HeartSafe Greater Williamsburg, an initiative to improve out-of-hospital survival rates for cardiac victims. She and her husband, Jacob Lambert, have 2 children. Adria, thank you so much for your service to our community and taking time to speak to our business community leaders.
Thank you. Excited to be on the meeting today and get the opportunity to talk about COVID. So I know it's always a very overwhelming topic, but I'm going to try to take some information and hopefully be able to put it in a concise manner that helps you understand kind of where we are at from a national and both state and local perspective. So I'm going to share my screen. Can everybody see that? Do you want to just give me a nod, Rick?
Yes, we can see it, Adria.
Okay. Sorry, I just want to make sure before I get started. So I'm going to try to take what can be a lot of information and try to make it as concise as possible and being very cognizant of everyone's time. So I do appreciate you joining today. But kind of going through a couple different things. So from the hospital bed status in Virginia, because that's important from our ability to be able to care for patients, the COVID-19 model projections, a brief data review, and then kind of how we arrived at the vaccination and what our vaccination distribution plan is, both at a state, local, and hospital level. And several of the slides that you're going to see today are actually produced via other organizations, and I think they do a really good job at making clear and concise information around COVID-19. So the first is Virginia Hospital and Healthcare Association. All of the hospitals within the state of Virginia report data daily to the Virginia Hospital and Healthcare Association. There is a little bit of a blip, and that you'll kind of see that on the next slide, on kind of how people report on licensed bed versus staffed beds. So we actually have a license for a multitude of beds, but then when it actually comes to staff availability to be able to take care of patients in that bed, that's another number. But for ICU beds, this is actual ICU beds available. So of ICU beds available across the entire Commonwealth, only 18% of those critical care beds are actually available. 82% of those critical beds are currently occupied. A little bit of a positive note on that is the ventilator use is actually not as high as we would particularly anticipate. So ventilators available or actually 65%. So that's a good number. We do have patients in critical care, but not necessarily on a vent. I know this is a very busy slide. This is actually produced by the Virginia Department of Health in conjunction with the University of Virginia. And they really look at adaptive models. So they look at adapted kind of being standard projections of where we see COVID going within the Commonwealth. And then they look at whether we are more constricted. So if the governor issues any stay-at-home orders, et cetera, that's adaptive more control, and adaptive less control is if we were to have less stringent restrictions in place. So if we didn't have universal masking, for example, that would be an adaptive less control. So you can see kind of projections looking out at bed capacity. This week is really going to be kind of when we start to hit above that 90% even inpatient bed capacity across the state. And looking at state projections, they really see the peak of what's happening right now not occurring until Valentine's Day. So anticipating that basically come February, we could be over hospital bed capacity in the Commonwealth. RAND is another organization that looks at a lot of data and creates models for the Commonwealth. And I think they do a really great job at giving a concise summary of where we are when it comes to COVID-19 in the Commonwealth. And you can see kind of high level, the case levels continue to rise, hospitalizations are rising rapidly. There are key triggers that are really driving this. So seasonality, people aren't staying outdoors as much as because of the cold weather. COVID fatigue, people are getting really frustrated with having to deal with the social distancing, masking, et cetera. And then the new COVID variant. So if you have listened in on any more recent news, you know that there are variants coming out, several different ones actually right now. And at least the initial variant out of the United Kingdom is 40 to 80% more contagious. So definitely a high concern there that we're starting to see that in the United States and particularly locally. And then kind of looking at it from a hospitalization standpoint, you can see that new confirmed cases are growing exponentially, so 4,500 a day on average. And this actually still includes a lag in testing and positivity from the holidays. So you kind of saw a little bit of a false dip in the holiday data around Thanksgiving, Christmas, and New Year's because people aren't going to get tested on those holidays. So we see a little bit of a decline or blip in the data that's really a false indication. So we know that the confirmed cases are growing and hospital cases are rising rapidly. The 7-day average is 2,700 hospitalizations and the positivity rate is 15%, so extremely high. Vaccinations are starting to reach healthcare professionals, and I'm going to talk a little bit and more in detail the vaccinations later on, but just to kind of give you a high-level idea from the federal government standpoint, there's 400 million doses from Pfizer and Moderna. That's roughly enough for 60% of Americans, assuming that there's no spoilage, so no issues with the waste of the vaccination. So both with Pfizer and with Moderna. With Pfizer, when we open a vial, there's 5 to 6 doses within that vial, and it has to be used within 6 hours. So if we, for some reason, don't have, which we have not had occur, but don't have 5 to 6 people that can take the vaccine that day, then that would be considered spoilage. With Moderna, it's actually 10. There's 10 doses per the vial. So that's a little bit harder on kind of the number of people that you have to have planned to be able to get the vaccine on the days that you open it. And then I think RAND does a really good job at really mapping and doing this heat map around the factors that are causing large increases in COVID within our Commonwealth. So seasonality that we talked about, more people are indoors, holiday travel, and then those areas that are going to help decrease COVID-19, so around the vaccine. And you can see that we're really not anticipated in the Commonwealth to see a large decrease in COVID-19 until the summer timeframe, beginning around July. So the variant of the COVID-19 is going to add a layer of complexity to this that we're still trying to kind of work through. From a vaccine standpoint, though, and really understanding, I think CDH does a great job at really mapping. You can tell that when the initial cases occurred in Wuhan, the work around the vaccine was already taking place. And mRNA vaccines have been in works for over a decade. It's just we haven't had necessarily that warp speed need to have that vaccine development. So you can kind of, some key dates around here. The first case was identified around November 17th. At the time, it was not known that it was a COVID variant. But then in January, BioNTech, which is a partner of Pfizer, actually started the work on the vaccine as early as January, even before the genome had been coded. And the genome was coded on January 10th. That's a huge, rapid increase in the ability from the scientific standpoint to be able to map the genome. So that used to take years, and it's now a matter of days that we're able to map a genome of a virus. The first dates and cases in the Commonwealth were around March 7th. World Health Organization declared a pandemic on March 11th. Just from our standpoint, we actually saw our first cases around that same time frame here locally in Williamsburg. And then you can see that the first kind of phase, sorry, there's people on that side. The U.S. government started the phase 3 clinical trials around the July time frame, and then the approvals of both vaccines in December, both for Moderna and Pfizer. So one of the organizations that works on kind of how we determine the distribution of the vaccinations is the Advisory Committee on Immunization Practices. They both assist with the approval and then also help guide the CDC on how we should look about the phases for the COVID vaccination. So I have 4 kind of slides that I think are really telling around how the Advisory Committee on Immunization Practices really helped guide CDC on how they determine those classifications for vaccination. So you can see that the COVID-19 incident rate is highest among young adults. So you can kind of see this 18 to 29 is the highest incident rate of COVID-19, and this was through December 16th. However, the mortality rate is actually the highest in the population that are 85 and above. I think one of the really telling things, though, is to consider is that even though the mortality rate in the population of 85 and above is already going to be higher because of age than the general population. And so one of the things that's really important in kind of how ACIP and CDC really looked at how they're going to go about the vaccination is also looking at the mortality rate based on the different classes of age. So you can see that relatively fixed rates of mortality. So from 45 up, you can see that the mortality rate is actually stable, essentially, in all of those populations. So that's definitely a concern around the mortality rate of COVID within populations that are 45 and above. And another really important factor in here is that over half of the essential workers are older than 40 years old. So not only do they have the kind of same mortality rate as 85 and above, they also make up over half of the essential workers, and I'm sure of your organizations as well. So these are factors that really help drive ACIP and CDC to look at how they divide the phases out. So VDH follows the CDC recommendation. So we're currently in phase 1A and 1B. So 1A is healthcare personnel, residents of long-term care facilities, and 1B is frontline essential workers, people above the age of 75, or those living in correctional facilities, homeless shelters, and migrant labor camps. Future phases to come are going to be 1C, so those are other essential workers, people the age of 65 and over, people 16 and above that have underlying medical conditions. So we are actively in this phase and have really started to expand, and I'll speak to Riverside's vaccination efforts at the end. And one of the things I think is interesting is to really look at how consumers are receiving the vaccine. So if you look at consumer willingness to immediately receive the COVID-19 vaccine, you can see that the initial time that the survey was taken, so October 22nd through November 9th, only 48% of respondents said that they were going to take it immediately. Since that survey has been redistributed, the November 18th through December 14th, you can see that that actually went up to 58% of the respondents saying that they're now willing to take it. Another thing that from a qualitative survey data, this is from Revive Health, really shows that really it's trusted word of mouth that's helping consumer safety perception around the COVID-19 vaccine. So initially, 42% of consumers want to delay or forgo getting the vaccine due to safety concerns, but they can be easily convinced. And I think that's one of the things as a business community, if you are willing and supportive to help provide education to your organizations, and by no means force your team members to be able to get the vaccine, but just provide strong information and sound resources so they can make a decision. And then some consumers says they won't be on the same page as their doctor. So this is a unique standpoint because typically we see in survey data that patients tend to really hold on to their doctor and their physician providers' recommendations. And you can see that creating avenues to be able to help people understand the facts around the vaccine is going to be very imperative, just given that this provider to patient relationship may not have as much merit as it typically does in other areas. So what are some great resources? You can see here Bradley Beam. So he kind of his reason for getting vaccinated. But there are some really great resources that are available. My slides are going to be shared. But the Virginia Department of Health really walks through kind of what the phases are. They have a great interactive quiz. So you can take the quiz on Virginia Department of Health's website, and it will help you understand when you will be eligible to get the vaccine. So you can help guide your team members to that if you want to kind of understand where they may fall. And then we also have resources on Riverside Health System. So we have a whole COVID-19 page that has a vaccine section that really walks through information as well. And don't be scared, that needle looks extremely long, but it is much more mild than even the flu vaccine. And then kind of breaking it down between Pfizer and Moderna, so these are some of the resources that are available on Riverside. You can see essentially they're relatively the same. The efficacy is about the same, 94 and 95%. The only difference with Pfizer is it was part of the clinical trials did include individuals that were 16 to 18, whereas Moderna was only 18 and above, and then some variance in the number of days apart. And there are some potential side effects, not unlike what you would get when you get your flu shot. So pain at the injection site, some fatigue, chills, fever, muscle joint pain, all of which are much more mild than potential downstream negative implications from actually getting COVID-19. So from a Riverside vaccination standpoint, some important things to look at is we've actually already vaccinated in that 1A classification over 6,000 nurses, doctors, and healthcare workers, both within and outside of our organization. So we have been partnering to help with paramedics and EMTs. So as you saw, Bradley Beam was getting his vaccination at Riverside Doctors Hospital. And then for phase 1B, we are doing an initial focus on Riverside primary care patients that are 75 above and frontline essential workers. But this is all going to be very dependent on ongoing supply. So the federal and state distribution of supply of vaccination will really drive the ability for local health systems and Virginia Department of Health to partner together to be able to distribute these vaccines throughout our area and the Commonwealth. And one way to really kind of stay engaged and understand when it is potentially your time or your team members within your organization's time to be able to get the vaccine. From a Riverside standpoint, we actually are sending notifications through our MyChart. So as soon as you reach one of the phases that are eligible, if you have a MyChart, Centera has MyChart as well. But I know from a Riverside standpoint, we actually are immediately sending you that message that you're eligible and giving you all the information on how you can call to get your vaccine scheduled. So it's just really important to continue to stay connected as much as you can, following those really sound resources with Virginia Department of Health, Riverside Health System. I know Centera has some really great resources as well. So I know that was a lot of information. I did try to keep it brief just so that way we could have time for question and answer, just because I know there are some things that I'm not necessarily going to cover from the initial data standpoint that you may have questions on that affect your organization.
Adria, thank you very much. I think one of the things that's been hard is to get accurate information during this crisis, and this information that you presented is very helpful and informative. So thank you very much for that information. And we will share the slides, as Adria indicated, so that you can become informed and review that information. There was a lot on those slides. I have one question. So if you have a question, please raise your hand and the moderator will allow you to speak through the microphone. But with all the challenges that the hospital is facing, what's the best way for the business community to come alongside and help? What can we do?
I think it's continuing to just encourage COVID-safe protocols. So ensuring that your organizations are masking. We, by all means, want to encourage that this is a great place to do business, and we want Williamsburg to continue to be a great place to do business. So having safety protocols in place that allow us to respect social distancing and universal masking, just to ensure that we have a safe environment, both for our citizens and people visiting the city of Williamsburg area. I think another thing is just to encourage your team members to just get knowledge around the vaccination, because we're not going to get past this without vaccination. So I think that just giving strong solid and concise information to your team members around the vaccine resources is one way to just really help us curb this pandemic that we're going through, because we're not in this is our third surge from the Williamsburg area perspective. The first one was around March. We had another one around the June-July timeframe. This is our third surge, and we're hitting the worst surge of all the kind of COVID surges that we've had thus far.
The hospital needs from us early on, people were providing food and all that, and it sort of lagged off in the summer when it seemed like COVID went away from Williamsburg, and now it seems to come back with an onslaught. Is there anything that you need from the business community?
I mean, anytime that anyone's willing to support us, we welcome that. But we also understand that from that standpoint that the businesses are taking a hit from the COVID as well. So we're always welcome to partner in any way that we can. So we try to work through various avenues with our foundation. And I know many organizations have been extremely gracious in donating chips and meals and even masks. So we definitely appreciate that, because we're able to supply those masks specifically at Riverside in our long-term care facility.
Great. Do we have any questions from the audience?
Yes, hold on one second.
I'm sorry, they're blowing leaves right out my window, so I hope it's not a huge distraction.
You're good. Ted Maslin, you can speak now.
Hi, Adria. We know that the VDH is tracking COVID cases by where the patient lives, the resident's jurisdiction. And it looks like they're trying to do the same thing with tracking who gets vaccinated. And we saw in the Virginia Gazette article on Saturday reporting that only 4 people in Williamsburg had been vaccinated so far, which seems to be misleading. Any comments on how we can be actually conveying to the public the extent of vaccinations?
Yeah, I mean, I think that there's a little bit of a lag in the posting data. So anytime that you get the vaccination, you actually also register with CDC under, you'll be given information around a program called Be Safe. So we are encouraging individuals to register within that because it allows CDC to also track if there's any issues with side effects, et cetera. So I think it's a little bit of a lag in the data itself. But you also have to think about the fact that we're in the initial 1A phase. We haven't even gotten the vaccine distribution to start 1B. And of that kind of where we are in the 1A, sorry, I was trying to reference one statistic because I think it will help kind of answer this. So of the vaccinations that have already been rolled out in Virginia, RAND, it's on one of my earlier slides, the RAND McNally model, 481,550 doses have been distributed, which is enough for half of those individuals, since it is a 2-phase vaccine, which is only 2.8% of Virginians. So there's only a small number of vaccines that have been distributed, and that was as of January 7th when this information was produced.
Well, no, I understand that. However, in the article, while it's saying 4 people in Williamsburg, it's saying 1,224 in James City County.
And I think you have to look at it relative to the population itself. So relative to City of Williamsburg's population versus James City County's population, I think it's also just a little bit of a lag in the data.
But based on what you said, if people don't register, they're not being counted in the dashboard. Is that correct?
Be Safe is how we register them to be able to get the vaccination side effects. The vaccine distribution is being tracked through Virginia Department of Health, but it also is dependent on the partners that Virginia Department of Health are working with, health systems being one example, on getting that information back. So that's what I'm saying. It's just a little bit of a lag in partnership of ensuring that all the various partners that are helping in the vaccine distribution are getting the data to VDH.
Thanks.
Any other questions from the audience?
There's a question actually in the chat. I don't know if you could see that, Adria, or if you want me to read it to you, from Kathy Howell.
If you could read it out, that'd be great.
Yeah,
Thanks.
do that. Kathy says we have a small office with private offices where we are half staffed. Is it safe to only wear masks when we're in the same smaller spaces versus wearing them when we're in our own offices?
So just to give you, I can give you the CDC recommendation, which is what we use here for our office in particular. So if I have my door shut and locked, I don't have my mask on. So that's how I'm able to give this presentation today. But at any moment, even if my door is open, I'm required to have a mask on. So that's just Riverside's policy, but it is following the VDH and CDC recommendations that one, that we don't do any in-person meetings, so we try to socially distance as much as possible, do everything via Zoom. But then anytime that my door is not shut, so basically when I'm eating, I have my door shut and I have my mask off, but anytime that you're gonna have your door open and that you have a potential to have an interaction with another individual, it's recommended that you have masks on.
Very helpful. Any other questions from the audience? Adria, obviously the Riverside Hospital is a great resource for other services. How do we help spread the message that the hospital is open for business besides the emergency room? And what are the primary services that our business community should look to Riverside doctors for?
Well, I think it's imperative, and I didn't include this in my presentation, but kind of a two-part answer to your question. But continuing to encourage individuals in the community to seek healthcare when they need it. And so we're very fortunate here in the greater Williamsburg area that we have two very strong healthcare partners, so Centera and Riverside. And just really encouraging, and both of us have been really pushing this message as much as possible. But there's data, there was a study in JAMA, so the Journal of Medicine, that really talked about the number of mortalities associated with non-COVID conditions. So things that typically don't happen and well beyond. We've never seen this of an exponential increase in mortality around heart attack, stroke, Alzheimer's, like all of the various kind of conditions that we're monitoring, diabetes, because people aren't seeking care. They're thinking that the hospital is too inundated with COVID, that we can't handle it. So I think it's imperative, even as we show these slides, to really talk about how COVID is impacting our ability to have bed capacity. We plan for these things. We have plans in place for surge capacity. We have plans in place to be able to ensure that hospitals can always care for patients when it comes to heart attack, stroke, et cetera. So I think it's just really imperative that you continue to encourage everyone in the community and at your businesses that if they're having any sort of medical condition, to not delay care, because we're seeing that negative impact to mortality and ways that we've never seen previous for a very, very long time, as long as it's been tracked. So the other thing is just to, from a healthcare standpoint, we just want to continue to encourage businesses to invest in Williamsburg and to choose to live here in Williamsburg. So as I said, we're very fortunate that we have two great healthcare partners in the Williamsburg area that are really investing a lot, not only from our ability to be able to take care of patients from a COVID pandemic standpoint, but also our investment in the community to bring services local. So I think that encouraging as much as we can to try to look at partnering with our local healthcare institutions for care, just because we're very fortunate from a community perspective to have that. Thank you.
And please extend our thanks to the super healthcare heroes who are in the hospital working hard every day. Thank you so much.
Yeah, absolutely. Thank you for the time.
Our economic development staff has been working overtime to provide support for our city businesses during the crisis. Leading that effort is Economic Development Director Michelle DeWitt, who will highlight some of the resources that are available to help your business. Michelle?
Thank you, Rick. Hello, everyone. Joanna is sharing a screenshot of what I'm going to talk about. So wanted to highlight that we still have the Cdbg business grant available. I'm hearing some feedback, so let me mute. There we go. The Cdbg business grant is still available. That's a $5,000 grant for COVID relief, and it can be used for, I got a great overview, if I can read it. It can reimburse expenses that includes rent or mortgage payments for the past 6 months, any PPE or sanitation equipment that you have acquired since COVID began. That grant is tightening in terms of what can be reimbursed, but we still encourage people to apply for it. So if your business was affected by COVID, which pretty much every business was, you can actually apply for rent or mortgage relief under this grant program. So reach out to us about that, please. The PPP2 has been passed, as you know, by the federal government, and as fast as we can get the details about that, we are rolling that out to the businesses. We do encourage businesses, please contact your accountant and your your banker so you are ready when this becomes available and can apply quickly. That also applies to the Shuttered Venue Grant, which is another federal program. It's $15 billion, but that's nationwide. So do y'all see something funny on your, oh, it's gone. And the $15 billion nationwide, so that could go very, very quickly. So we want our venues to be prepared for this grant. So again, get with your accountant, your lender, your banker to work on this. We have directly communicated with the venues in the city, including Movie Tavern, Colonial Williamsburg, William & Mary, Escape Room, and others. But if you know any venue which they've all been affected by COVID, please let them know about this program. And then lastly, something exciting that we've been working on and talking about for a while is an update to our wayfinding system. As you know, in 2007, a regional wayfinding system was installed that started at Interstate 64 and then came down to all the tourism venues in preparation for 2007. As a city, we are looking to refresh our part of that, and we are having our first public meeting about that on January 19th at 4:30. If you go to our website, yeswilliamsburg.com, you'll see more information about how to register. This will be an interactive meeting, even though it will be virtual, because it's really important for us to hear from the public as we're shaping what wayfinding means and how it reflects in a creative way what our community stands for, and can be useful to give people directions so they know where to park, they know where to shop, they know where to dine, they know where our tourism venues are, but also something memorable that reflects Williamsburg. So when they go home, they tell their neighbors what a cool place, and the wayfinding system was part of that process. So I'll turn it back over to Rick. Thanks.
Thank you, Michelle. Even though the city offices are now closed for the second time, our employees through the EDA have been working hard throughout. So the phone number that was on the screen, please call them, make an appointment. They continue to be available. They have worked hard to put over $1 million back into over 100 businesses in our community. So really critical effort through the last 10 months. So thank you to Michelle and your team of Yuri and Joanna for continuing to work hard for the businesses of Williamsburg. Please reach out to them to see how they can help you or questions that you have. It's a great starting place with the myriad of different opportunities that are available for help. Our next Business Roundtable webinar will take place on Tuesday, February 9th at noon, and we hope you'll join us and let others know. We hope to continue to provide this kind of information, really timely, useful information for our business community. Please take care of yourselves and those around you and make it a great day to do business in Williamsburg. Thanks so much.